YouTube. I am Dr. Rabiul. I work as a lecturer of pathology in a medical college hospital, and I am making this video for my students. Hope someone finds this useful. Now, today's topic is IgA nephropathy. Now, whoa, don't just run away. I know it sounds hard, but I'll try to make this as simple as possible. So, IgA nephropathy. What does that mean? So, we are having two parts in this thing, IgA nephropathy. Now, IgA, we all know that's immunoglobulin A. That is the secretory type of antibody in our body that is found in different types of body secretion. The second part we are talking about is nephropathy. That means here we have some problem in the kidney. Okay, now IgA nephropathy, sometimes it's also called IgA glomerulopathy, and that is even more specific. Glomerulopathy means we have some abnormality in the glomerulus. So literally IgA nephropathy means abnormality in the glomerulus due to immunoglobulin A deposition. Okay, now we'll keep it there. Now, to proceed further, we have to know a thing or two about glomerular diseases. Now, this is important. To understand IgA nephropathy, you need to know the different types of glomerular disease. Okay, so glomerular disease are mainly of two patterns. One is called nephritic type and the other one is nephrotic. So, nephritic, at the end of the sentence, at the end of the word, we have itis, and we all know the itis suffix stands for inflammation. So, in the nephritic pattern of glomerular disease, inflammation plays a key role in the damage. So remember one thing, glomerular disease are of two types. One is nephritic, which is inflammatory, and in that type we are having glomerular damage due to cell proliferation, mainly by neutrophils. Okay, now the other type of glomerular disease was nephrotic pattern. In the nephrotic pattern of glomerular disease, the main problem is in the basement membrane. Okay, cellular proliferation is not the factor here. Here, the glomerular basement membrane is getting damaged, losing its negative charge, which used to repel negatively charged proteins from passing out of the glomerulus, and that leads to protein in the urine, which is known as proteinuria. So that is nephrotic type. Okay, so now that we have talked a few words about nephritic and nephrotic type, can you tell me which type of glomerular disease the IgA nephropathy is? Yes, it falls in the category of nephritic disease. So, if we summarize now, IgA nephropathy, there is abnormality in the glomerulus due to deposition of immunoglobulin A. It is a nephritic type of glomerular disease. Now, can you tell me what are the other examples of nephritic type of glomerular disease? This is nice to know. The other examples are post-streptococcal glomerulonephritis. Then we also have crescentic glomerulonephritis, which is also rapidly progressive in nature. Okay, and so on. So now we know that IgA nephropathy falls in the nephritic type of glomerular disease. Now, what will be the clinical feature of a patient who will have IgA nephropathy? Okay, the patient will come to you with complaints of dark urine. You know, dark urine, what's that in pathological term? Hematuria. Yeah, presence of blood in the urine. The patient will complain that. Now, one thing you have to remember, this patient may in most cases give a history of either pulmonary infection or GIT infection few days back, and that is very critical. The presentation will be like this: the patient had infection either in the respiratory tract or in the GIT, then he or she got dark urine, then the infection subsided, the hematuria subsided. When the infection recur, the hematuria recur again. So that will be the common presentation, and you will also find that the patient will be hypertensive. Why hypertensive? Because remember, in all nephritic variety of glomerular disease, we will have hypertension. Okay, so that is very important. We will have hypertension and we will have hematuria. And the patient may also have some localized edema. For example, in the around the eye, there will be puffiness. Okay, so these are the common features of a patient of IgA nephropathy. Now, one thing you have to know, these same features are also found in another variety of nephritic disease. That one was post-streptococcal glomerulonephritis. So how will you differentiate these two clinically? Well, the main way is duration. Okay, if the patient had IgA nephropathy, then the history of infection prior to the dark urine will be 1-2 days back, not long ago. In case of post-streptococcal glomerulonephritis, the history of sore throat or other infection, that may be a long time ago comparing to this one. I mean, that may be 1 or 2 weeks ago. Okay, and we will further confirm these things with laboratory diagnosis, but this is just one clinical feature that you may have to think about. Okay, so now we have known what is immunoglobulin A, what is nephropathy, what is IgA nephropathy, which group of glomerular disease it falls into, and that was nephritic pattern, and we also talked about the clinical features. Okay, so now some other important points. IgA nephropathy is the most common glomerulopathy. It is commonly found in Japan, France, Austria, etc. Okay, so it can occur in children, it can occur in adults. Now, let's go a little bit more deeper inside the matter. Okay, so what is the mechanism of IgA nephropathy? What's happening here? Well, we know after infection, I already mentioned that in IgA nephropathy, most of the times you will have a history of previous pulmonary GIT or other infection. So what happens when we get an infection? Our body produces a lot of antibody against those things, and in this case a lot of immunoglobulin A is produced. Then what happens? This immunoglobulin A goes in the circulation, and through the circulation it goes to the kidney. And then what happens? These immunoglobulin A's selectively deposits in the mesangial cell of the glomerulus. Now this is important. Remember, in nephrotic pattern of glomerular disease, we also see antibody depositing in the glomerulus. But in those cases of nephrotic syndrome, antibodies are deposited not in the mesangial cell. Those antibodies are deposited in the basement membrane. But in case of IgA nephropathy, the antibodies are getting deposited in the mesangial cell. That is very important. Okay. Now, what is a mesangial cell? You may ask naturally, Jay, what is a mesangial cell? Okay, so in order to answer that, we have to think about the histological structure of nephron and its surrounding architecture. Okay, so nephron is the structural and functional unit of a kidney, right? And above the nephron we see the Bowman's capsule, and inside the capsule there was the glomerulus. Okay, now if you think this is the cross section of a glomerular capillary, then what is lining the inner side or the luminal side of the capillary? Can you recall? Yes, inside the lumen we have endothelium. Okay, then what? Outside the endothelium there is a negatively charged basement membrane. Okay, and then outside the basement membrane in the kidney we will see some special epithelial cell which will also have a special type of food process. You know, if you think my hand is the epithelial cell and the fingers are the food process, then it will just stay like this over the basement membrane. Yeah, you think I'm getting crazy? Okay, so just try to visualize. This is the cross section of the glomerulus. You will have endothelial cell here. Outside that you will have the basement membrane, and outside that you will have the podocytes. Okay, and outside the epithelial cell which has podocyte, there lies the mesangial cells. Okay, and mesangial cell, what is the function of mesangial cell? It produces the matrix. Okay, so the immunoglobulin A will get deposited inside the mesangial cell. That will lead to proliferation of the mesangial cell, and we know if the glomerulus gets damaged due to cell proliferation, that falls in the category of nephritic syndrome. Okay, so what will be the outcome of this thing? The outcome is variable. The IgA nephropathy's outcome is variable. It may be benign, and sometimes it's recurring over and over and over again, and that may lead to renal failure, slowly progress to renal failure, and by slowly I mean around, say, over 25 years. Okay, and since the prognosis is variable, so is the treatment. Commonly we try to treat this thing with immune suppressive drugs like corticosteroid, because this is happening due to immune complex deposition. So we try to slow it down with immune suppressant drugs, and also we have to treat the hypertension. You know, since this is IgA nephropathy, falls in the nephritic variety, so hypertension is always an issue that has to be taken care of. Okay, and one thing I have to say, if we look at these glomerulus under electron microscope or with immunofluorescence, what will we see? Okay, we will see immune complex deposit in granular, or which is also called lumpy bumpy appearance, immune complex deposition in the mesangial cells. That is diagnostic. Okay, now before concluding, I have to mention one more thing, that IgA nephropathy is sometimes associated, often associated with some other diseases such as Henoch-Schonlein purpura and celiac disease. Okay, now celiac disease, I have a separate video for the celiac disease, so I'm just skipping that for now. But let's talk about Henoch-Schonlein purpura. Okay, so what do we have at the end? Purpura. So yes, here we will have purpura mainly in the buttock and legs. This is a very common childhood systemic disease. It also involves the abdomen. The patient will also complain of abdominal distension, GIT bleeding, and also joint problems leading to joint pain or arthralgia. So keep that in mind also, that Henoch-Schonlein purpura and celiac disease may be associated with IgA nephropathy. So this is in short about IgA nephropathy. Hope you liked it.